Hi everyone, Dr. Jeff back with Noah this week. And last week we talked a little bit about the autonomic nervous system and how it balances things in the body. And there's two kind of sections to it. So this week we're going to talk a little bit about chiropractic and how we can kind of play and manipulate that autonomic system a little bit.
Yeah, so a little review from last week's video. We have two branches to the autonomic nervous system, the first one being the parasympathetic nervous system. And so that's essentially your rest and digest response there. So it decreases your heart rate, puts more energy towards digesting your food as well. And so that system originates from the upper neck area. And then we have the sympathetic nervous system, which is essentially the opposite. It's your fight and flight response. So it elevates your heart rate, heightens your senses as well. And so that essentially originates from every vertebrae in your spine.
Yeah. So there's been lots of research done in chiropractic and the nervous system and how we can kind of play with it a little bit. The four main areas that they've kind of come up with, one is your bowels, indigestion, and heartburn, breathing, and colicky babies.
Yeah, so sometimes we'll have patients coming in with low back issues, and after getting their back adjusted, they find that their bowel movements become more regular, and their constipation and diarrhea may clear up.
Yeah, and along that time with indigestion, even heartburn, we are creatures of bad posture, and you're spending a whole lot of time on your computers or on your phones, and that thoracic spine kind of gets rolled over, and the neck gets pulled forward, and that can lead to some indigestion and some heartburn. Again, when you come in and we treat that area chiropractically, we treat that area, get the spine working better and the nervous is working better. Patients will say, my heartburn seems to be less and I'm getting less indigestion.
And so to piggyback off that, so sometimes people come in with poor posture, maybe text neck, and then after getting a adjustment or having their posture being fixed a little bit, they'll notice that their breathing becomes less restricted and their airways open up a little bit.
Yeah, I found especially with kids, I found that they're coming in and they have what we call exertional asthma. So they're fine until they have to go run or you get a smoky or smoggy day. I found that treating them, they respond quite well. That quite often we can really help with their breathing. The other last one we want to talk about was colicky babies. If you don't know what a colicky baby is a baby that cries 12, 14 hours a day, so a lot of crying with it. In Denmark, a lot of research for kids has come out of Denmark since for a long time Denmark covered the chiropractic for kids up to the age of 18. So lots of research has come out of Denmark. One of the thoughts behind colicky babies is that it's all about the acid in the stomach, and that you need acid to digest the food. And the parasympathetic system is responsible for getting acid to the stomach because it's for digestion. The sympathetic system is the one that turns it off. So sometimes what can happen is that the parasympathetic system isn't working properly, babies will eat, and what happens, they can't digest it because there's no acid in it getting to the stomach. So it just sits there and ferments, and the baby's stomach gets quite upset, gets quite gaseous. The other thing going to happen too is after they've eaten and they've digested the food, they start to cry because again the sympathetic system can't turn that acid system off, and so that the stomach gets very irritated by the acid. If you've ever seen a baby being born, what happens is the head comes out and gets tilted to the side before they pull the shoulder out. That can really wreak havoc with the neck at the top. And again, we talked about your parasympathetic, and that's where your parasympathetic is kind of from the neck. And again, they're kind of curled up in the womb. And what first thing you do is flatten them out on the table to measure them and see how long they are. Again, that can wreak havoc with the sympathetic system. So again, this is going to create an imbalance between the parasympathetic and the sympathetic system. So another way to explain how the autonomic system works is I like to use a dimmer switch. So let's say that your kidney is not working very well. So the doctor kind of looks at your kidney and says, okay, your kidney's not working, so I'm going to give you a medication to make your kidney work better. The way I look at it is, okay, the energy starting up, we talked last week about up, down, inside out. So the energy starts up in the brain, winds down through your spinal cord and out to your kidney. And there's something blocking that. So let's say I have a dimmer switch and I dim the dimmer switch down about halfway. Well, the kidney's only going to work halfway, half efficient, because there's not enough energy getting to that kidney. If I turn it all the way down, the kidney's not going to work at all. So that's one of the differences of how I look at things and how your medical doctor looks at things. Your medical doctor will look at things and say, okay, the kidney's not working, so we're going to have to do something about the kidney. Whereas I look at it and say, okay, is the energy to the kidney there? So up, down, inside out. So is the energy getting there? So I look at the spine and make sure the spine is working properly, make sure that the nervous system is working properly. And if it's working properly and the kidney's still not working, then that means there's something wrong with the kidney. But if the kidney's not working right because the energy's not getting it, you can do whatever you want to that kidney, and it's not going to get any better until we get that energy system working better. So again, that's one way that how I look at how the energy system, everything works in the body, and how your doctor looks at it. Just a little bit different. Again, that's how we play with the autonomic system and make sure that all your organs are balanced and everything's working properly.
This chart shows how your spine and nervous system are connected to the rest of your body. Each level of your spine innervates certain organs, muscles, and regions of the body. As we went over, if a specific region of the spine isn't functioning properly, it can affect those connected areas. That's why regular chiropractic care is important. It helps keep your spine and nervous system functioning at its best, supporting your overall health. So guys, make sure to like the video here, make sure to hit that subscribe button, and if you have any questions for me or Dr. Jeff, just leave them in the comments down below, as well as future video ideas. And here at Goldsworthy Wellness,
We got your back.